take you under whatever name you give us, ma'am.
All right, well, it's 3:33, so we'll kick this off. Good afternoon and welcome to today's legislative listening session. Since this is a Zoom meeting, we ask that you keep yourselves muted until it's your turn on the agenda to speak. We do encourage questions, and you can type your questions in by clicking in the chat box in the lower part of your meeting window. This meeting is also being recorded, and a link will be provided to you within about 2 business days. Thank you again for joining us today. And now I'd like to welcome Melanie.
Thanks, Mitch, and thanks for putting this together. So welcome, everyone. Thank you so much for taking time out of what has been a surprisingly busy day, week, month, etc., for being locked in your house. I don't know about you, but we've certainly stayed plenty busy. For those of you who don't know me, I'm Melanie McAleenan. I'm the Director of Government Relations and General Counsel for the Association of Counties. And we decided to take advantage of some of your copious amounts of spare time that I just referred to by doing a total of 8 of these webinars. This is our 4th. So we did 3 last week. We have 5 this week. So we're keeping plenty busy. We grouped the counties by region as best we could. So some of you who have multiple counties in your legislative districts might want to sign up for more than one of these because we couldn't figure out a better way to do it, frankly. And we'd love to have any or all of you on every single one of our calls. If you'd like to do so, you are more than welcome. And also, please feel free to share the information with others. Others are welcome as well. We will start today with about 20 minutes of public health overview. Dr. Anthony Chin, the Director of Health of the Tacoma Pierce County Health Department, will give us a status update and let you know where we are. And even though he's only from the one county, he'll be able to speak more broadly than that. We wanted to be really cognizant of the amount of time we took from our public health officials. So we really tried to limit ourselves in inviting just one, and so everybody else could just stay working and we weren't overwhelming anyone. So we'll spend about, like I said, about 20 minutes with him. And then we will move on to about 25 minutes, so roughly 5 minutes per county, to talk about the impact the pandemic and their response to the pandemic has had on county functions, county budget, things that that they have had to do that's outside the normal course of business, so to speak. And this, there is just all kinds of a huge range here, and you'll see the slide. We put some talking points on there as ideas, but really we welcome anything that you want to talk about, because it could be something like you had to go buy laptops from Costco because your staff couldn't work from home because they had desktops, but you still needed county functions functioning. Or it might be that you had to shut down your planning department, or your budget's getting whacked, which I think is going to be a theme. So it's really across the gamut. And creative ideas you've had, responses to solving your problems. That's a lot to talk about in 5 minutes, but just kind of let us know where you stand. And then after that, we'll spend about another 25 minutes looking ahead. What needs attention going forward as we dial back out of this pandemic? What needs attention? What do we need to be thinking about? What's keeping you up at night? What do you anticipate your new normal to be? I heard someone say today that they weren't going to use new normal anymore because nothing's normal anymore. So it was, what do you anticipate your new to be? So we will look forward to hearing what your ideas are to come out of this pandemic with as healthy as possible and as economically healthy as well as possible. And then we will have hopefully about 20 minutes for questions. If you do have questions, like Mitch said, you are free to type them into the chat box, and we will, kind of depending on whether it makes sense at the time, either answer them right away or more likely than not save them until the end. but you're welcome to type them in there so you don't forget it, or unmute yourself at the end and go ahead and ask the question out loud. Either way will work. And with that, I am going to turn the floor over to Jamie Bodden. She is the Managing Director of the Washington State Association of Local Public Health Officials and WASHTC staff. We are very lucky to have her because she has been a huge asset throughout all of these last many weeks. And so I will let Jamie introduce Dr. Chen, and we'll go from there.
Thank you, Melanie, and good afternoon, everyone. Happy Monday. Just your daily reminder that today is Monday, although all the days seem like they're probably blending into each other. It is my pleasure to introduce Dr. Chen to give kind of the local public health response. Many of you will recall during session, it seems like a long time ago, but during session, I talked to you all about COVID, gave you guys some updates, even back in February and March when session was going on around the situation. So local public health has really been on the forefront and on the front lines of this response since January, and working really hard, really nonstop around the clock. So I'm very proud to introduce Dr. Chen, and just very proud of the work that all of the local health jurisdictions are doing to protect our communities and keep each other safe. So Dr. Chen, with no further ado, I will turn it over to you. Thank you.
Hi, Jamie. Just want to make sure everyone can hear me okay.
Yep, you sound loud and clear.
Great. So Jamie, are there going to be slides that I need to go over, or is this just, I'm just going to provide the update?
Yep, we'll move forward. We'll move forward the slides for you.
Okay, great. So do you want to go to the next slide? Right, so I think just about everyone is pretty much engaged in doing some kind of COVID-19 response. I know Snohomish had the first case, and then King County got hit with a really large number of cases. Pierce County kind of trailed both of them, but pretty much I think is, when I last checked, I think just about every county has had cases except maybe one, but I need to check on that. But if you remember, we were all paying attention to this. We've had long-standing public health emergency plans and response plans for things like pandemic flu. We exercised some of that back in about 11 years ago during the H1N1. But I don't think anyone, even though we were prepared and we had that practice 11 years ago, I don't think anyone was quite ready for what we are going through right now. So, you know, we were doing information, making sure people were aware of what's going on. We're dusting off our plans. We were monitoring travelers, and we were kind of coordinating among ourselves. Next slide, Jamie. But then when cases started showing up, we kind of moved into what public health always does. And even though we're on the stage right now for COVID-19, you know, we do this all the time, whether it's with TB, tuberculosis, or sexually transmitted diseases. When someone has a case of an infectious disease, we do what's called disease investigation or case investigation. And then from there, a lot of people now are hearing about contact tracing because we want to know if someone has an infection, who they might have come in contact with. Then we want to make sure that people get tested to see if they might have this disease. And then, especially in this case, we would talk about isolation and quarantine. And just a reminder, right? Isolation means someone has the disease and we want them to stay home and not be out spreading the illness. Whereas quarantine are people who have been in contact with someone who has the disease or been in an area where there is the disease. They don't actually show symptoms now, but we want to make sure they stay at home and are not out spreading the disease because many people can shed the virus even before they develop all the symptoms for it. And then now we're all, trying to stay home. Those are some of the community measures, right? The governor has closed schools. He canceled large events. He now has asked people to stay home. And the whole intention there is these diseases spread because they jump from person to person. And if we spread people out, if we remove settings where people can very easily spread it to other people, we can slow this disease down. And a lot of these public health measures, I mean, when we don't have a cure, when we don't have a vaccine, public health measures still work. Whether it is with COVID-19, Ebola, any of these other diseases that we have, these public health measures have been shown to work. But they work in a very different way than what most people think about. But of course, in addition to this, there's a lot of local agency coordination. So for example, here in Pierce County, even though because it is a public health emergency, the health department is leading the emergency response, very close coordination with the county's emergency management, and of course, coordination with schools, healthcare systems, a whole lot of other partners. And communication and messaging, as you know, is always so important. Next slide, please, Jamie. And now, we're at this point where we have been able to slow some of the spread of this disease, but people are getting stir crazy, right? And there are real impacts. So if you go out and look, right? I mean, in our neighborhood here in Tacoma, stores have closed, and some permanently. Some are looking like they're going to be out of business permanently. Many people aren't able to work, and they're worrying about, are they going to be able to pay the rent? Are they going to be able to afford their bills? But the really important thing for people to realize is, you've all seen the pictures about flattening the curve. We are flattening it, but we're not coming down the other side yet. Right? So here in Pierce County, for the past couple of weeks, we've been bouncing at around 20, 25 cases a day. Now we've had some dips, like the other day we were down, I think, to 17 or 14 cases a day, but then we also had a day where we had 65. So it's bouncing around, about 20, 25 right now for us. A few weeks ago, we were bouncing in a bigger range, around 20 to 45. So in general, it's coming down. And at our peak, I think we had like 90 cases a day. Now, these are much better than King and Snohomish, but this gives you an idea that we're flattening it, but we're actually still going up, 20, 25 cases a day. So we're not decreasing completely yet. But then the only reason that we're sitting on this plateau is because everyone has contributed to the social distancing, the community mitigation strategies, but people are getting anxious because they feel they need to get back to work. They need to be able to move around more. But it's very clear from the data that the governor's looking at that's coming out of some of the institutions in Seattle, the Institute of Disease Monitoring and the Institute for Health Metrics and Evaluation, that the reason that where we are now is because of these restrictions. And if we let them be too loose, or we loosen them up too much, we're going to bounce right back up. One of them actually called this a very precarious situation where we're on this unstable equilibrium. And I always remind people, it's like, when you have high blood pressure, you go see your doctor, the doctor says, take your medication and your blood pressure comes down. I mean, you still keep taking your medicine, right? I mean, unless you've done all the other things like lose weight, exercise, change your diet, all that, you're still going to need to continue your medications until you can do those longer term changes. And that's where we are now, that we are doing okay, but it's because everyone's been participating in these very kind of onerous restrictions. So it is buying us time. So we're planning for what happens if we get another wave, or as we loosen things up, what if the cases start going up? What I just remind people is, here in Pierce County, we have, about 900,000 people. And we right now, we've only had like 1,300, like 1,300 people have gotten this disease, which means, clearly less than 1% of the people are immune to this, which means anything we loosen up, 99% of people could catch this disease. And when you think about that in that way, you just have to realize you have to do this very carefully. But you've probably heard by now the big issues about as we loosen this up is we need to be ready to get right back on top of it. So you heard me say earlier, we need to be able to test people, we need to identify the cases, we need to do contact investigation, we need to do contact tracing, we need to help people, make sure that they can do isolation and quarantine so they're not spreading it further. That's a big lift. And this is the only way that we have seen other countries be able to control COVID-19. Now you can imagine that then in order for us to do that, we're going to need to add a whole lot of staff. We've had some estimates here in Pierce County. I've asked our staff to project what would it look like if we had to do twice as much, 2 times, 5 times, 10 times, and 20 times the number of cases investigated, because that's very possible. If we can truly open up the testing, we know that there are going to be more cases. If we get a second wave, or as we start to see an increase as construction opens up and other businesses open up, we need to be ready to jump right in there. And so, we've had estimates of we might need anywhere from like 120 to 250 staff. Considering that our health department, we're the second largest in the state, and we have 280 employees. So you're talking, 50% to 100% increase in our staffing just to keep up on all these cases. I'm sure that each of your counties are looking at this as well. And, over the past few years, as Jamie has mentioned, you've all heard about the Foundation of Public Health Services. This, what I'm describing is a Foundation of Public Health Service. Now, we have a surge situation where we've got a pandemic, but as I said, even if there was no pandemic, we would need this infrastructure if there's a TB outbreak, if there's a measles outbreak, a mumps outbreak, pertussis outbreak, right? So we've had all of those in our state in the past few years. So luckily, those are much smaller than this, but you can see that you need to have that infrastructure available, or if anything comes along, you're not going to be ready for it. Next slide, Jamie. So I think this is the transition point. Is that right, Jamie?
It is. Thank you, Dr. Chen. Just a reminder, if you have questions, feel free to list those in the chat. And I have just a question for you. Perhaps, Dr. Chen, you can describe, you've talked about case investigation. Perhaps you can describe a little bit of what that looks like locally. You get a positive test result. What happens after that, and kind of that scope of work, especially as we ramp up this effort and expand staffing by 50 to 100%. Obviously, there's a lot of work that's involved with that. So if you could just briefly describe what that might look like at the local level, that would be great.
Yeah, let me give you an example of a situation. I'm going to kind of blur some of the facts a bit so as not to reveal confidentiality. But we had a case early on where there was someone who worked for one of our big community institutions, worked for one of the schools, and so it was a positive case. So as soon as we learned it was positive, we contacted that person and said, okay, who do you live with? What kind of work do you do? They work for a school district, but they do all kinds of different things. So it's very different if you're a bus driver versus a teacher versus someone in janitorial staff, right? So all of these kind of help us understand like who might have been exposed. You all know we need to be 6 feet apart, right? That's because this infection is spread through droplets. So let's say you just drive delivery trucks for the school district. That's very different than if you are, a teacher or one of the people who's in a classroom all the time and you're in very close contact with other kids. Well, we also found out that in the home, his family members are sick as well, right? So the spouse worked somewhere else. They had kids who, you know, school-age kids, so they were in school as well. So this is exactly what happens in contact investigation. We get, the contact is kind of like the tip of the iceberg. And then it's a lot of shoe leather, and now I guess it's on the phone and virtually, right? But just figuring out what do they do, where they've been, and in this case, right now we found out that the family members are showing symptoms. So of course they need to get tested. Then we need to do contact tracing of those kids. You can imagine the kids are in school. They might be in sports. In some cases, they're in schools where they go to other schools because there's some shared programs. And this web just keeps getting bigger and bigger. And then we're doing assessments all along the line to say, well, when this person went to this other school, was that a significant risk? Are we advising that school to, quarantine that class or what? Who should get tested? What are the recommendations? And so it's not only a lot of time to do this, it requires a lot of interpersonal skills. You can imagine, for example, I think the most obvious ones when we do HIV or STD investigation, we're talking very personal, like who did you have sex with, right? And do you have sex with men, women, or both, and how often do you have sex, how do you find your partners, right? These are some very sensitive information. And even for COVID-19, people worry about their jobs or they're worried about, stigma or whatever, then our staff needs to have a certain amount of interpersonal skills and be able to get this information, assure them that it's really for a good purpose, but get the right information from them so we can do our work.
Great. Thank you, Dr. Chen. Much appreciated. Melanie, I'm going to go ahead and turn it over to you. Just again, a big thank you for all of the work that you're doing with Tacoma Pierce. You guys are innovators as always, and very proud to have you as one of the local health jurisdictions I get to work with in the state.
Yeah, thank you very much for taking your time today. We really appreciate it. So as I mentioned, we will start by spending about 5 minutes per county talking about what you see on the screen, the impact on county functions, and just what it has meant to be in your county in the last 6 weeks, 2 months. And I think we will start with Thurston County. I see Commissioner Hutchings, and if anybody else from Thurston County wants to chime in too, of course, that's fine. And we'll move on from there. Commissioner, take it away.
Thank you, Melanie. Excuse me. I'm going to start with, my report's pretty dour, so I'll start with some less dour news, and that is FEMA. FEMA may not be covering the emergency response to the level they have in the past. That's the good news. Overall, in Thurston County, we have 100 confirmed COVID cases and one death. 95 of those 100 are recovered or recovering. And I think there's 1 or 2 in the hospital, but there's no one in ICU. And our health officer retired back, I think, in November, December. And so we've been operating with an interim because we had had contract with state health officers, but then COVID happened, and so they had to be reassigned, of course. So we have an interim health officer now, and we're going through the hiring process now. We had a final interview just about 2 hours ago with a candidate. We are still providing our county services overall. We did close our waste and recovery section to self-haul only. We shut that down for about 3 days due to staffing issues because those folks were high-risk personnel. We've got that open and we're operating at normal services now. Our housing and homeless, we've identified a process for quarantining individuals if they have nowhere else to go, and especially if there's a spike, to include leasing a hotel. Our food banks, just like everybody else, they're still functioning. They're strapped, but they're still up and running. And we did provide regulatory relief for permitting, for any permits that might be lapsing. We've extended them through the end of September. And the same with our water and sewer relief. There's no shutdown. Those folks have 3 months to pay. Environmental health permits extended to the end of September as well. Our property tax, we delayed to June 1st. Our treasurer decided that was an appropriate date. And regarding public safety, we have no confirmed cases in the jail at this point. And we've shut down work release, the sheriff has. We're only taking mandatory arrests for domestic violence and a certain number of DUIs within a certain period. The prosecutor and the AOC are working together to implement further processes. All referrals now are to the prosecutor rather than getting booked into jail. But we have overall reduced our jail population by about 30%. Regarding budget, we're expecting about a 20% loss in sales tax. Property tax will be reduced. There'll be some reduction there. We just don't know. It's too early to tell what that might look like. Excuse me. And then we're working with Public Health and Social Services, our health officer, to recommend to the BOCC how we're going to start ratcheting up and opening up the county again. But we will end up ultimately, like everybody else, end up with a reduction in staff and levels of service. And that's it for Thurston County. If there's any questions, or Romero, if you're still here, you can chime in as well if I've left something out.
Sure, thank you, Commissioner. Anyone else from Thurston County like to weigh in?
Well,
This is Romero Chavez. No, I think Commissioner Hutchins covered it.
thank you, sir.
Well, thank you. Appreciate it.
Thanks to you, Romero.
Let's then move on. How about King County? I know Councilmember Lambert is on the line, and because that's who I can see on my screen. So if there's anyone else, I apologize, but please feel free to chime in, and we'll start with Councilmember Lambert.
Thank you very much. And I appreciate these calls a lot. As Anthony Chen said earlier, King County has had quite a much larger impact on number of cases and number of deaths. And I'm very curious to see why King County was hit so much harder than the other counties. So as we look at other counties, I think we're going to need to ask you, what did you do differently than what we're doing? We have spent a lot of money. We believe somewhere around 123 million has already been on the plan so far. And we have leased many facilities, such as hotels. We also have another hotel for our first responders so that if they can't go home, that they can stay at this hotel in Bellevue. We've seen an increase, of course, in domestic violence and mental health issues. And we had to spread out the people from our mental health institution because they were in too close a proximity, and spread them out. That is causing major troubles in other cities. And I think as we come out of this, we're going to have to figure out what we're going to do with the mentally ill and also the drug-dependent homeless people, because we can't put them back all in the same place as they were before. So mental health is an incredible issue. A lot of people are facing depression, and both child abuse and spousal abuse are things that obviously leave scars for a long time. So not only is this a financial problem, but it is also a societal problem in the fact of the mental health of people going forward, and potentially an increase in divorces. We did let out 600 people from our jails, and unfortunately, some of them are already back. And that's going to be a problem because people are going to be very upset. You had them in jail. Now they got out of jail and they've done whatever they've done. So mostly, I'm understanding, it's mostly been car thefts. But anybody that stole my car, first they'd be in big trouble because of the mess. But there's a lot of stuff in there that is irreplaceable to me. So it is a very personal thing when people have their cars stolen. So I think the criminal justice issues are going to be huge. A lot of DVs backed up. And of course, the cost for all these facilities that we have rented, and then finding people to man the security of these facilities. I had one city call me this morning and say, I just want you to know that our security guard is on a walker. And that wasn't very helpful as far as they were concerned. So there are many aspects to this, and I think knowing in the end, what are we going to do with our mental illness? If we had a well-functioning Western State Hospital, many of these people belong in a well-functioning state mental hospital. I was in the legislature when they decided to close those facilities and bring people back to the community and do the infrastructure that was needed. That was 20 years ago, and that has not happened. So we are now facing problems that I think we need to reshape and relook at. So when this is done, I think we have, as a state, a lot to talk about are these policies still the same policies that we want? And if any of the other counties have ideas, why King County's number is so much higher than everybody else's, I am very interested in that. Thank you.
Thank you, council member. Appreciate your time. Do we have anyone else from King County who'd like to weigh in before we move on to Kittitas County? Okay, I'm not hearing anybody. I'm talking slowly just in case someone's on mute. But I know Commissioner Oshadas was going to be joining us. So if you're on, please chime in, and anyone else from Kittitas County. We tried to get a good mix of large and small counties for this call.
Good afternoon. Thank you for having us. This is Laura.
Hello.
So quick rundown, Kittitas County, I'll have to talk to Kathy about the various cases. We only have 14 cases in Kittitas County that's been confirmed, and most of them have recovered, and we have 0 deaths, and we are sandwiched. The interesting thing is we are kind of in the middle of other counties that do have quite a few based on per capita cases. So, you know, Yakima County and King County and even Grant County have significantly higher cases than we do here. But we've, you know, I can share with what we've done. I really don't know what we've done differently, but I think as we talk about that, we might be able to figure that out. The treasurer's office, Amy Siskey's on the line. So after I'm done, I'm gonna let her talk a little bit about what she's done in her office to assist with some financial issues people may have. And, you know, what we're discussing a lot right now is just the amount of pressure. I think partially because of the limited amount of cases in Kittitas County, we've been getting a lot of pressure to reopen Kittitas County, as I think probably a lot of other smaller rural counties have. So that's, you know, we've just been working with our legal staff and with our health officer, and, you know, just trying to really work together during this time because it's challenging for a lot of reasons. Financially speaking, Kittitas County's been hit very hard because we do, especially in the upper end, which is where I reside in District 2, up in the Cle Elum-Roslyn area, there's so much of the service industry and tourism that's been affected. And an example of that is the resort in our community. Suncadia is completely closed, so all of those workers are out of work, which is challenging for us. One of the things that's been really wonderful is how people have been resourceful and giving when they can. We have the Heritage Distillery up here in Roslyn, and they went from distilling whiskey to distilling sanitizer, and they donated a lot of that to our local EMS and fire department. So they had that on hand when there was a lack of supply in the area. And then as far as county facilities, one of the things on the east, especially on the eastern side of the state, that we deal with a lot is wildland fires, and we were having, it's been fairly dry, and our solid waste facility was not taking yard waste. So we were having a lot of people burning yard waste, which caused some air quality issues as well. So we did decide to go ahead and open back up the yard waste portion. We never closed the garbage portion of our transfer station, but we have had our yard waste back open for about a week. And so it's been really busy, but you know, we're trying to really weigh the challenges between wildfire, people being home, able to do some fire wising, and the amount of people going in and out of our transfer stations. So that's what I have, unless you guys have any questions. And I know Amy's on the phone, so I'll let her talk about the treasurer's office a little bit.
Hi, this is Amy. Thank you, Laura.
Yeah.
So our office worked, well, all treasurers in the state worked really close together on deciding what would be best for taxpayers. And it turned out we all kind of decided we each needed to take our own approach. As a new treasurer, I was extremely grateful to have such a fantastic team of people to work with. So I think each and every one of them. In the end, our office, our county decided that we would do three different tiers of tax payments. So people could pay 50-50, 50% of their taxes were due this month, and then the next month in May. And then the second option, payment plan option, was to do 50% now, and then 25% in May, and then another 25% in June. And then, or they could go on a 6-month payment plan. We let the taxpayer decide really what would be best for them. We didn't decide to do everybody's eligible if you apply. We just ask that you apply by the end of the month. We actually have only seen about 35 people apply for the tax relief program. So I'm hopeful that that means that for the most part, people are in pretty good shape for April. We'll see as this goes on what it might be like down the road in October. But for April, we're actually on a track for collecting what we should collect about this time. So that's all I've got from our office. We're working hard to stay up to date, opening mail. That's been our biggest challenge with the limited staff, but we're doing a pretty good job.
Thank you. Do we have anybody else from Kittitas County who would like to speak before we move to Pierce?
Sure, this is Jerry, the county auditor in Kittitas County. And thank you guys for doing this. I'm hearing these have been very important. I'm also the president of WACO, which is, I'm trying to monitor how things are going on throughout the state for all of our different affiliates within that organization. A little bit of the struggle that we've had, thank goodness it's not countywide, but one of the 10 counties who are currently running election, which tomorrow is election day. So when you think about the struggles when we're supposed to be fully transparent, open to the public, same day election day registration, face-to-face new voter registration for 8 days prior to the election, and how do we manage all that with a closed courthouse and election going on? I think we've managed it pretty well. Thank goodness it's only a small election within one of our small cities, which is the Upper County in Cle Elum. But the concern we have with that is that we're looking at a very small turnout. A lot of people are more focused on the issues at hand, their livelihoods, the issues of getting their taxes paid, the issues of dealing with COVID-19 and all those kind of things, which I think is contributing to a concern I have as to whether or not that levy issue on the ballot is going to work for them, because it is a renewal of a levy lift for their fire department. So these are the kind of things that I think many people throughout the state aren't realizing that we're all dealing with, and it has to do with the operations of some of our essential services and how they're going to be funding these essential services. So many of the other counties are dealing with school district elections, their O&M levies, and some bond issues. And when we look at trying to run an election in this type of situation, it becomes not only difficult for us as far as the operational side of the election, but it becomes a concern of the the agencies who have asked to have a proposition on the ballot. So just as an interesting thought process of what we're going through right now, we're making it work, but there's a few struggles, but and again, the auditors usually make this stuff work with elections, but it provides concerns about how these things are going to do. At the end of the day tomorrow at 8 o'clock, we'll find out how they do.
Well, I'm glad you mentioned that because that has come up a couple of times with other counties, but since it's not universal, it's really interesting to hear how people are dealing with that. So thanks for sharing. I appreciate it.
Very welcome.
Anyone else from Kittitas before we move to Pierce? Okay, Councilmember Young, since you're who I can see on my screen, I am going to ask if you will kick it off and then we'll see who else we have on the line.
I will, and I think I saw our auditor, Julie Anderson, on as well, so I'll make sure to save time for her because she's got some important stuff to share, I'm sure. I guess I don't want to repeat too much of what the others have said, but I think it's important to emphasize not only the size of the budget hole that we're going to see develop in our budgets unless we see some revenue relief from the federal government. It now seems clear that we can't use CARES Act funding for filling that revenue hole. We had hoped that there would be a clarification there to the positive, and that's not the case. If there is no revenue forthcoming, we're going to be making deep, deep cuts. And it's going to be really uneven because I think one thing that people forget is that our revenue is really compartmentalized and restricted. So some of our revenue can only be spent in, say the unincorporated area or only on a certain subject. So like, we have the behavioral health tax, or you have housing taxes, or you have various other different sources of revenue. In Pierce County, for example, we have a criminal justice tax that is tied to mostly the jail that we've basically emptied out. And that will continue, those bonds will continue to be paid. And we have a little bit money left over for some countywide justice services, but it's not as simple as being able to say, okay, we're doing less of this service now so we can fill this hole. So I would hope that our legislators could give us as much flexibility as possible coming into this budget year, and even thinking some previously unthinkable things. So for example, we are still seeing a significant amount of REIT revenue coming in. Continuing to limit that to construction or to capital projects is something that I remembered from the last recession when I was on a city council. The public is really confused why we were continuing to build parks while we couldn't afford to maintain the ones we had. And the reason is this kind of wonky way that we raise revenue in the state. So I'm hoping that we can visit some of those issues, give us some flexibility so we can put the funds where they're needed. On top of all that, we're seeing a spike in demand for services. I expect that most counties are in the same situation, but I know here in Pierce County, we already had a high percentage of folks that were on the margin that are really being hit pretty hard. And we'll need to get those folks back to work when things do reopen. One of the things that they'll need is transportation. And transit districts, if you don't have it within your county budget, again, not having fungible dollars, are getting hit hard, not just because they're mostly sales tax based and it's highly localized, meaning the poorer counties like Pierce raise much less money than our peers. But also we're having trouble just with staffing levels because a lot of drivers, frankly, didn't feel safe. That's completely understandable. But as a result, we're having labor shortages there. So transit service has been decimated. We're seeing similar problems in other areas as well. Even just food distribution. So we've been backstopping our emergency food network as much as we can in this crisis. But the reality is that there's much more demand, and delivering those services is very difficult to, under the normal circumstances. And now kind of operating a drive-through operation with prepackaged food, it's a very different business. I want to note that as we restart things, it's not all going to go smoothly. Our justice system is going to be very backlogged, and it was already, frankly, understaffed to begin with. So just as an example, we have in Pierce County about half the judges, prosecutors, and public defenders that that King County does, but we actually have more felony filings. So that means they're going to have to deal with that backlog of cases. And frankly, that's one of the places where we may be looking for some cuts if we don't see new revenue. Finally, the last thing I would add is that each county is a little bit different, but there's a couple of us that have large urban unincorporated areas. In those areas, we are expected to provide urban level services, much like a city would, and we have city type revenue, but we don't have all the revenue sources that our cities do. It's going to be even harder to serve those areas. So if there's something we could do to continue to push either to give us access to the same sources of revenues as cities for those areas, or to encourage annexations and incorporations, that to me is going to be critical, because we're caught in between two different situations where we are a county, but we're serving a very urbanized population. And those two things have never mixed well, but we're sitting on a situation now with rapidly declining revenue where it's only going to get worse. I'd like to then introduce our auditor, Julie Anderson, who, as many of you know, has been very active on a number of election issues in particular.
Hey everybody. Well, after listening to Councilmember Young, I'm once again, on behalf of my employees, we feel very fortunate in the auditor's office, auditors, and
I
yes.
need to cut you off for just a second. You are very warbled, and you already have your video off, so I know it's not that. Are you on speakerphone or anything, or just hoping we can get you a little more clear?
How about if you pass me up and I call in for audio?
That will work. So why don't we then, while we're waiting for her to call back in, let's switch gears and we'll just stick with Pierce County, but let's talk about what we need to be thinking about moving forward. So Mitch, you could go ahead and advance the slide, and let's talk about what you anticipate moving forward. What are your needs? What are your wants? What do you think you can do to help, etc.? And so I guess, Councilmember Young, I'll turn it back over to you for a minute while we try to get Julie back on.
Great. So the main thing is continued support for public health services. I think, no matter what, we are not getting ourselves out of the situation reopening to the degree I think everyone wants to without a robust test, trace, and isolate program. As Dr. Chen noted, that's extremely expensive. If we're going to stand up a program in Pierce County, that's what I would say is a level that is necessary in order to feel comfortable. It is going to cost an extraordinary amount of money, and we're going to blow through most of the CARES Act dollars that we have with that. And just between that and our emergency response systems, that's taking up the bulk of the revenue. So, I think when we saw that we were getting direct revenue because we're over 500,000 population, that we had this giant pile of money, that's great. The problem is that literally almost all of it's gone before we really had much to think about. So I'm certain that once the state passes on the revenue to the other jurisdictions that didn't get a direct appropriation from the federal government, they're going to be saying the same thing. So I think it's really important that we emphasize first things first. Public health has to be able to hire up as much as possible very quickly.
Thank you. I don't believe she's back on. Sorry, I have to move one screen to be able to look at the other. Let's go then. I have a quick question.
I think I see the auditor on there now.
Oh, you think she's on? Okay. Auditor Anderson, are you back on the line?
Oh, maybe not. I just see your name there.
Well, let's take just 1 minute where I want to jump in with two things that we have in our list, and we can get to the rest of them in a minute. But or when, when we're done talking. But first I wanted to say that Councilmember Lambert makes a good point that I wanted to make sure our county people on the phone knew to fill out your NACO form on financial issues so they can report it. She says that only 400 out of over 3,000 counties have reported. So you might want to take a look at naco.org/coronavirus and fill out that form so they have accurate information. And then Eric, I'm putting you on the spot if you don't mind. Just a very quick update on the CARES funding, because we do have a question. Does anyone have any idea when we will know how much each county is going to get from the COVID-19 funding distribution, when that might occur, and what we'll be able to use it for? So maybe just a couple minutes on that if you can.
Yeah, great. This is Eric Johnson. Hopefully you can hear me. I'm on my computer and it sometimes breaks up, but I would let you know that yes, if you tuned into the governor, he announced that they would be allocating $297 million to the counties and cities that are beneath 500,000 people. That will include the cities of King, Pierce, Snohomish, and Spokane counties. Those cities within those jurisdictions will be getting some money as well. And so it is anticipated in the next several weeks, Department of Commerce will enter into an agreement with each city and county for the distribution of those revenues. I have seen a chart that illustrates how much money each jurisdiction would get. It is based off of each county would get $60 per capita for both its incorporated and unincorporated population. So that's $60 per capita. Each city would get $25 per capita. The minimum a county would receive, so our small counties would receive a minimum of $250,000, and our counties, cities under, or cities minimum would be $25,000 per entity. So we do have some movement from the governor's office. We're hoping within the next 2 to 3 weeks we would start seeing contracts. As far as what it can be used for, we have posted the U.S. Treasury guidance before. We will be resending that. I think maybe even as early as this afternoon or tomorrow morning. Derek will be preparing, and Mitch will be preparing an email going out to the WASAC membership, our affiliate groups, to let them know what we anticipate for each jurisdiction based off of a spreadsheet. It's not final, but a spreadsheet that was provided by the governor's office. And then also we'll post the U.S. Treasury's guidance on eligible activities. Keep in mind, it is primarily related to COVID response and the costs that you have incurred that is not budgeted for COVID-19 response. You can also use it for a variety of other purposes, but that's definitely it. It cannot be used, as you heard from Councilmember Young, it cannot be used for lost revenue during this period of time. So that's a quick snapshot of what we think we know now. And it's not all finalized, but it's certainly moving in a very positive direction for our communities.
Thanks, Eric. Auditor Anderson, did you make it back on the line? Okay, well, we'll go ahead and move on. And if she does make it, we'll go back to her. Let's go then back up the list to Kittitas County. Commissioner Oshadas, if you're speaking, you're on mute. We can't hear you. And I don't know if who else was on the line.
Yeah, this is Laura. What can I answer for you?
Just moving forward, what scares you? What's keeping you up at night? What do you think that you could do to help you, the county, could help move us out of this episode that we're in now into healthier, both in terms of physical health, but also economic health going forward? And if that was something you could do, what would you need to be able to do it? Just kind of what impacts do you see moving forward for your county? Will you be cutting staff, do you think? What key matters need attention in order to dial back activities back up? Just stuff like that, just kind of the forward thinking situation.
Yeah, so what we've been talking a lot about, or what I've been talking with some of our staff about, is really having something in place for our small business owners to reopen. You know, what does a safe workplace look like? If there are guidelines we can give them, and I know there's some of that available already, but sometimes people need something a little bit more specific than a really generic document. So we're working here at Kittitas County to put together some guidelines that people can really say, okay, this is what I need when the governor states that we can reopen our doors, because we want to make sure that our business owners have a plan in place ahead of time so they're prepared, rather than, you know, sitting around and then after the fact being, you know, kind of playing catch up and trying to get their plans in place to reopen their doors. So that's something in regards to small businesses. I'm sure many commissioners have had endless calls with our small business owners, as we have here in Kittitas County, but we have a lot of people that, you know, are scared. They don't quite know what the next step is. And as leaders in our county, we're trying to help provide resources the very best we can and to provide some sort of direction. The, you know, the finance piece of it is also something that as we move forward, you know, what is that going to look like for us? We're fairly lucky in Kittitas County that we have, hold on one second, stop. We're very lucky here in Kittitas County that, hold on one moment. Sorry, I had to mute myself for a minute. We have school at home and it's fun. But as we're trying to figure out what our small businesses need and what the economy is going to look like here, are the sales revenues down, our lodging tax revenues down. There's a lot of unknowns, but one of the things I was going to mention that we are fortunate for in Kittitas County is, and I know Paul's on the line, so I'm not trying to, you know, make his head too big at this moment, but we did have some commissioners in the past that were very thoughtful in how we spent our county funds. So we do have a decent rainy day fund budget that we've been able to look at how we utilize for this sort of a situation. So we do have some emergency reserves that we've been able to look at and we have available to us that probably won't solve the problem altogether. Actually, I know it won't, but it will definitely help us get through this. So we are fortunate in that regards in Kittitas County that I know some of our other county partners are, but it's staffing's, you know, obviously a concern. Is where we have our enterprise funds if we aren't getting the amount of work in that we were. And some of our general funds, you know, if we don't have the revenues or, you know, law enforcement, we have the 3/10 tax for our law enforcement and what that may look like as far as sales tax goes for some of those positions that are funded through that. We have a lot of, probably a lot of very long, detailed conversations that are in regards to that.
I was on mute. I try not to do that, try not to be the cliche, but I was on mute. Thank you, Commissioner Ochatos, really appreciate it. Anybody else from Kittitas County? Okay, so I think that's a great segue back up to King County, because one of the notes that I was going to mention from Councilmember Lambert was a plea about the small businesses, which she had put in the group chat. So why don't we go ahead and turn it over to King County, and then we will finish up with Thurston County in a minute.
Thank you so much. I made my list real quick so I can go through it. One of the things the legislature can help us with is the non-supplant language. we really don't need non-supplant language. I understood that when I was a legislator, but now that I've been on the receiving end of that, I will say prayers for my doing that when I was a legislator that I'll get for forgiveness. So when I get to the pearly gates, I don't get kicked out because I put non-supplant language on. So getting non-supplant language out of our budgets would be very helpful. It's to cover public health and public services for mental health. There's no way that we are not going to do that at all. Plus, especially now. And the paperwork of dealing with that is wasted time and effort and money, and we don't have any of those to be wasting. So if you could remove the non-supplant language, that would be wonderful. The issues with the Open Public Meeting Act, I know that they've gone back and forth about how long we can be meeting by remote. But as long as we need to vote by remote, we should be. And the interpretation of necessary business is being interpreted so finely that we are saying after every piece of legislation, the reason we did this today is because we have to have it done by such and such date. So when you have 58 items on the agenda and you have to take the time to explain that, it's again a waste of time. And basically, it should be, we're doing it because it's county business, and county business should be being done because a lot of things are happening in addition to the fact that we have COVID. So if you could remove that, that would be helpful. And also, if you could make an exception during a pandemic that the council members can talk to each other in a meeting about what do we do about the pandemic. I think it's important for us to be able to have those conversations, and obviously we can't. So it's not good. We too, like others have said, need to get our small businesses back up and running. They are the lifeblood of the rural communities. And because most of them have less than 6 employees, they can social distance. And we were told that we would need about 700 employees for contact tracing. And we will be getting some from the National Guard, but that's still a lot of our own employees that we will either have to train because it's not something you just know intuitively. And so that will be an issue. Having the money to do our basic services so that we don't become a lawless society. People are very concerned about that, especially as we've opened and expanded some of our shelters. I had a mayor call me this morning and saying he's never had so much dirt and graffiti in his town, his city ever, and they're just very upset about it. So we have to do that. I also like to put a plug in for the medical examiners and coroners. I've been on federal calls where they've been talking about the data collection nationally. And I will tell you, as a member of the statewide Forensic Investigation Council, that we are not going to be a whole lot better than the rest of the country because we don't have enough authority to standardize it. So in a pandemic, the FIC board can't say, okay, here's the data that you need to keep. We can ask them, could you please keep this data? But they could tell us no. And I think when we're talking about something as serious as a pandemic, it'll be studied for over 100 years, I'm sure. And we need to have the ability to standardize that information. And then the last thing I want to say is I want to put a plea in for an essential service, and that is hairdressers and barbers. So if we could open those up, I think many of us could be a little happier. So thank you very much.
Thank you, Council Member. That was great. I want to make sure that people saw this. Julie Anderson is typing to us, so I wanted to read this to you in case people weren't looking at the chat box. She says, sorry, my audio isn't working today. I hope that counties can work together to make a list of things to keep. In our office, we've had to rapidly retool service delivery. Frankly, some of it is an improvement. For example, remote notary service is currently authorized by the governor. We need to make that the norm, not the exception. And there are many other examples. There are also examples of emergency orders that will need to be stood up again if COVID rebounds or we experience another emergency. It would be great to have a suite of policies that could be triggered. It doesn't have to be as painful as this time, which is a great point. I think all of that. So it has been really interesting to hear some really clever ideas people have come up with that we will need to remember as we go forward. We don't want to lose when this pandemic is over. So thank you. Even though we maybe can't see you or hear you, I appreciate that you typed that in. And now I will, if we don't have anyone else from King County, I will turn the floor to Thurston County and Commissioner Hutchings and Auditor Hall.
What I'd like to do is give my time then to our auditor, Mary Hall, because she didn't have a chance to speak earlier about a major issue that impacts all counties. And then I'll mute it because the dog.
Thank you.
Thank you, John. I do agree with Julie. I think it's important. Everything I do in my office is required by statute, recording, licensing services. I also oversee county finance and of course elections. The one non-essential service that we offered was passports, and we did cease that just due to safety concerns. But coming up to the 2020 general election, primary and general elections have some real challenges for every county. And you hear across the country how they want to encourage everybody to go vote by mail to protect voters. But we also need to look internally what that process looks like. What we are struggling with right now is how do we, number one, retain our seasonal staff that are in that high-risk category and encourage them to come back in an environment that is probably not unlike a meat packing plant. They are shoulder to shoulder, and we simply don't have a big enough space to continue that type of operation. We have same-day voter registration, and if anybody's been into the Thurston County Elections Office lobby, it's incredibly small. It's probably 15 by 20 feet and nearly impossible to do any type of social distancing. So we're finding ourselves having to look for a secondary facility. We've got a building that the county owns that a bank is moving out of. However, we've heard that they're having permitting issues. So how do we talk to the jurisdiction to get the permitting moving along so this bank can vacate this facility so we can do something on the lines of drive-through voter registration? Now, I'm just speaking what I'm looking at in Thurston County, but every single county auditor in the state is having to look at these same situations in a year that is already insanely busy just trying to gear up for a presidential election, and we're doing that with the resources we currently have. Now, we did get a federal CARES grant, but I'm not sure that that money is going to go as far as we all think it will. If I get in this building, it's going to require, probably some remodeling and things like that. And this is the most expensive election that we hold in a 4-year cycle. And I know the state almost unanimously in both the House and the Senate authorized, funding elections, but it's got an effective date for 2022. One huge benefit to the counties would be to move that effective date up to make it effective in this presidential election year. I also oversee county finances, and watching a budget presentation. We're only a couple years out before we're going to be in the red, and we actually have a pretty healthy fund balance, but there's so many unknowns right now. We don't know, what percentage of property taxes are going to be collectible, what's going to be the reduction in sales tax revenue, and those are the only two revenue sources we have. So while everybody is going to really have to tighten their belts, when you're a department that provides state services at the local level, it's very difficult to do that. So anyway, I just hope that we can get some relief, and that's just one I thought of, was changing that effective date. And every single person we keep employed is going to help restart that economy because they're going to be out there spending money in the community. So I'm hoping that we don't have to have huge staff reductions across the county, but at this point in time and looking at forecasts, I think that's really going to be our only option.
Thank you. Those are some really great points. And I'll give Commissioner Hutchings the chance to say something if you'd like. I also would just point out that Julie Anderson said as well that it's been interesting to operate an office that's 100% state essential services, but operate within the county fiscal structure, but that also the federal election funds have come very fast and very well organized from the Secretary of State's office. So at least there's bright spots in places that things are actually working well and efficiently. Since so many places were not prepared for this, it's nice when there's one that's working well. So Commissioner, would you like to say anything before we move on to questions and answers?
I'll just add that it's not a complaint, but that when I hear some of the misconceptions that the counties are mismanaging money, and or Thurston County has plenty of money because that's where the legislatures live and operate, it drives me nuts. So it's an educational piece. It's a positive. That's all. Thank you very much. I love this session.
Thank you, Commissioner. Appreciate it. So you all have done a masterful, I'll just start over. You've done a great job staying on time is what I'm trying to say. So thank you for that. And so we do have about 15 minutes. We can open up for questions. I've been looking through the chat box, and I think for the most part, what's in here has been covered. I'll point out Commissioner Hutchings mentioning that the demand that all functions, parks, and services open immediately is a challenge. We certainly have some very restless people who maybe didn't get the message that if this works the way we want it to, it'll look like we overreacted. All they're seeing is the overreacted part. And so certainly I think counties are really seeing the challenge of dealing with anxious people as much as the state is. Just to scroll to make sure that I've got everything in here. I think I pretty much have, and you can type into the chat box or feel free to just unmute yourself and ask a question. Councilmember Lambert has a great point too. When parks open, they'll also need help with parking and garbage. That's a great point. We have a lot of facilities that are on reduced services for solid waste, and that will definitely have an impact for sure. And I don't know if we're planning on cordoning off every other parking spot or something like that, but certainly there are places where people will back up and social distancing will be very difficult. So great points. Does anybody have any questions they'd like to raise? Feel free to just jump in. You know, we don't have to unmute you. You can unmute yourself.
Yeah, this is Senator Hunt. While we're talking about bad news, our budget office tells us that the deficit we are to expect is somewhere between $5 and $10 billion. So, trying to look for more money from the state. If we don't get money from the feds, if we can't break through that Senate barrier, we're going to be in a world of hurt, state and local.
For sure. Yeah, not good news.
This is Jeannie Darnielle. Just want to echo Sam's comments. I almost wince, Kathy, when you say, the state could step up or Mary, when you say the state could ramp up the elections money earlier. I think we'll be hard pressed to hold on to it at all. So looking at the situation with that Sam's mentioned about what we're learning about the hemorrhaging that's happening at the state level, it's well over $200 million a week lost revenue. So anything that we all experience, Kathy, you were in the legislature during the last recession. Sam and I are still there, but anything we experience then is going to pale in comparison to what's coming up. And so I think if anything, the counties might need to be prepared for some of the same arguments you made 10 years ago about the need for the services at the county level, and know that it's not a situation where it's falling on deaf ears, but we just simply could be facing as bad a situation as you have in terms of maybe different outcomes like public safety and education and human services programs, but we don't get to print it. You know, we don't get to print the money in Olympia, you know, much as we would like to do. And I'm not looking forward to those same arguments again about whether or not, you know, one aspect of the budget is more important or less important than another. But we are going to be having those conversations again, unfortunately.
I was just glad though, that Jeannie and Sam, thank you very much for you and your colleagues and the what you're doing and the tasks you have ahead of you as well. Thank you.
Thank you. I want to thank all the legislators on the phone for taking their time today and for listening to us. And having been a legislator, I do know that it isn't easy, but it's also not easy at the county level either. And partly because we can't talk to each other as much as you guys can talk to each other. And that becomes a horrible problem, especially in the commissioner counties where there's only 3 commissioners and so you can't even talk to each other. That's a bad thing anyway, but then you make it in the middle of a pandemic where you need to say, well, what do you think about this? And what about that? And did you hear this? And so it makes it very difficult. The other thing is that there are so many regulations, and I think somebody else mentioned it, maybe it was Mary mentioned it earlier. There's so many regulations that many things that we could do without so many regulations, like when they rebuilt the Skagit Bridge, they did it in a couple of months. This is a good time to start looking at what regulations do we have and what do we really, really need? Because there are regulations that sometimes my staff brings into me and I'm like, are you kidding me? Is that really serious? Yes, and council member, it'll take you an extra year or 2 years. You know, our founding fathers talked about the government being closest to the people. And I think looking at what the functions are and saying, okay, it can be done probably more efficiently closer to the people, but not if the money doesn't come. But we could probably save money by doing it closer to the people and not going through all the layers to get it down to us. But the certain amount of money needs to come because many of the things that did come down to us came out with no money. And so we have been struggling for a long time because of unfunded mandates. And so I just want to throw out there that unfunded mandates need to be not happening because it's not fair, but being able to say, what could we reduce, and asking us, what could we do to make your life easier so you can actually get this function done as quickly and as efficiently as possible, and then helping us to waive or get rid of some of the paperwork that goes on and on and on. And I'm not saying to be, you know, like the Wild West, but sometimes it's not even practical anymore. So good luck. And please feel free to call any of us that have been there before, because there's many of us in the county family that were legislators before. And we'd be happy to say, commiserate and then give you our insights. So, but commiserate mostly sometimes. Thanks.
Thank you. And given that we're talking about the revenue problems and that we are all going to share them, I think it's great that we're hearing ideas in terms of maybe areas where we can be more flexible with existing funding and more flexible with regulations and things, just so we can learn how to be more efficient. And it doesn't even have to be something that's permanent. If we did something that was, you know, for the period of a few years or something, just until we can get back on our feet, that would even be something to think about. And so we'll definitely be coming to you legislators in the future, I guess sooner or later, when you go back into session, to talk about some of those ideas. I'm really glad that they came up today. And I also want to say thank you to Representative Paulette, because he's not showing up on my screen. I don't know if he's showing up on others. I just want to make sure you all know that he's on the line as well. And he's the chair of the local government committee in the House. He has been on almost every phone call we've had so far. So he's really listening in, which I definitely appreciate, and we'll be sharing ideas with him too. We still have a few minutes left, so if anybody wants to weigh in, we will happily take additional questions or comments.
Melanie, this is Jerry.
Hello.
Good afternoon again. So one of the things that's been happening within the Waco organization, and is every Tuesday afternoon, we have had a phone call for any of our affiliate members that want to call into that call and talk about the things that we've been doing internally within our counties to work through this process. One of the things that's come up with that is exactly what Julie said on her in her chat, was we're looking to come up with some ideas that we could potentially push forward to the legislature, where some policies or policy areas may be in place in the future as any type of emergency, or in particular maybe this type of emergency comes down, to where they can be automatically or relatively automatically implemented to not only help the state but to help the counties as well. So we're going to be looking at some of that discussion, and then hopefully being able to talk with our legislators, and thank those legislators who are on the phone today. Thank you very, very much for listening to us, because I think these are some of the ideas that are coming from your local elected officials that I think really, really want to help you come up with ideas of the ways that could help us, as well as you operate more efficiently and effectively as these types of things hit us in the future.
Thank you. I think that's right on. And in our chat box, there's a few comments. Mary Hall says we're all in this together, and Representative Tina Orwell is also on the line. Also, I can't see her in my list. Great feedback, much work ahead, stay healthy, and I hope everyone is staying safe and healthy and not going too stir crazy. There is a light at the end of the tunnel, even if we can't see it yet, and hopefully it is not a train. It is good news ahead. We'll get there eventually. Julie Anderson says, a big round of applause for legislators. We really appreciate the complexity of the problems you're facing, and we're deeply appreciative of the collaboration and fact-finding with counties. And I think that is such an important point to end on, if no one else has any other questions or comments. But we really do feel like the counties are your partners and want to be your partners, and want to help you solve the problems that you're facing, and hope that you feel the same way about the counties, and that we can all work together to get through this the best way possible. So we'll come to you with ideas, and we hope that you'll come to us with ideas as well, and that we can get through this. I will also tell you that WASAC has been doing webinars and phone calls with all of our local affiliates. So if any of you has any questions about what's going on in solid waste, what's going on with the county engineers or the planners or etc., we have been having regular communications with them as well. So if you have a question about anything, even if it seems kind of random, we probably, if we don't know the answer, we know somebody who's been talking about it. So I welcome that opportunity as well. And Councilmember Young, I think I saw you light up, so I'll turn the floor over to you.
Thank you. And that I hate to go back and end it on a bad note. So take everything that was pleasant and nice that Melanie just said and think of it coming after me. Because I did want to add one thing that I hope legislators are thinking about. My guess is several of you are, knowing the issues that you work on. One thing coming out of this that I do think might be a place where there may need to be some targeted investment is I am deeply concerned about the impact that this has had on kids. It's not only their academics that are the issue. As most of you are aware, schools are where we get eyes on, and kind of a window into what's going on in a kid's life. I've been talking with some teacher friends of mine, and they're like half their kids in some cases have just disappeared. They haven't heard from them. They don't know what's going on. And from someone that's been working on trying to reduce dependency cases in Pierce County, this has me deeply concerned that, we're losing connection with these kids, and that we may need to deal with a considerable amount of trauma coming out of this. We know that family stresses and economic conditions are deteriorating, and that's always going to be a problem. But the fact that we don't at the same time have a third-party adults, able to see what's going on. I think that's something we need to be thinking about as you go into these special sessions, because it's deeply concerning to me. So we're going to try to do some stuff at our local level, but I hope you're thinking about it at the state.
Thank you. And we've gotten a couple of notes in since you said that. Might be an unhappy note, but a very important one. Senator Wilson says she's working on this with DCYF and OSPI, also on summer programming and childcare. So great. Thank you very much. And Representative Mylan Tai says she's interested in the OPMA. So I will send you a note about that and we'll follow up. So anybody else have anything they'd like to talk about before we sign off?
Just one other thing, I may have missed any discussion about the changes in the executive orders, especially the one regarding the release of persons from prisons and work release programs. And by now, there's been quite a wave going back into counties at this point. They're probably, I don't know, close to half of the people that they predicted that they would be releasing from DOC are now back in communities. And I just want to leave the door open to send me a note, give me a call if you have information you want to share with me about that. Thank you.
Thank you, Senator. Appreciate it. I think that people were really scared when they saw the lawsuit that was filed with the Supreme Court. And so appreciate the more specific planning the governor was able to do with his executive order, that wasn't, that was just very much more tailored and had people who already had release plans and things like that. So definitely that was helpful and a little less scary for people in terms of what do we do in terms of housing or food scarcity or healthcare services. And those were all the types of things that people were pretty worried about when we saw that. So I don't know if anybody wants to say anything about that, but I think we appreciate the thoughtfulness that we ended up seeing, and I haven't heard any horror stories, but that doesn't mean they don't exist. So I don't want to speak for everybody in that regard.
Hi, can you hear me? This is Rep. Graham.
Yes.
Hi, I just wanted to say thank you for the opportunity to listen in and hear concerns and hear ideas. And I'm really looking forward to working with my colleagues on great ideas to help us move forward into safety and prosperity again.
Thank you. Appreciate that. And just one last word on the executive orders, and then we can let you go. And just generally, as we're moving forward, we're noticing maybe a lack of desire on some parts of the Four Corners to not extend the orders broadly, but just like we had the PRA and OPMA one is a great example, in fact, because it was going to expire and there wasn't a willingness to move it, say 30 days. They just went to May 4th. When we know we're still going to have to be implementing some form of social distancing and business is not going to go back to normal on May 4th, the ability to have more clarity and certainty going forward with some longer term orders would certainly, I think, be helpful. So I'll just put a plug in that regard that we hope we don't have to do this, say, once a week or whatever it happens to be. But the ability to have those has certainly made life easier in some instances. So we do appreciate it. Any final words? It's 5:01 by my clock, so I don't want to keep you, but any final words before we say thank you and have a great evening? Okay, I don't see anything. So thank you and have a great evening.